DaVinci Robotic System represents a real technological advance in the field of minimally invasive surgery. The DaVinci Robotic System really represents an amalgamation of many different technological advances to bring together a surgical system that a surgeon such as myself can utilize in performing an array of different types of surgical operations. The system involves a series of arms, robotic arms, which have sophisticated surgical instrumentation. And one of the key features or advances in the robotic system, in the DaVinci system, is that these instruments mimic much of what we do with our hands. The instruments are movable in ways that our hands are movable. They can grasp and move and turn just like our hands often can. And in fact, these instruments are designed to do even more than our hands can normally do naturally, with articulation features in many different degrees of freedom beyond that of which we can normally do in surgery and beyond what we can normally do with other minimally invasive instruments. A few things that are special about the DaVinci Robotic System are that the image quality is really superior to anything else that we have available in minimally invasive surgery today. The reason for this is that the imaging system involves a 3D image. There are in fact two digital cameras mounted on a laparoscope or a digital scope that is used surgically, and it provides a very highly illuminated field for us to view. So there's a great deal of light on the subject, and then we have these very high resolution images created by this DaVinci imaging system. It gives us a three-dimensional image. It gives us an image that is very rich in texture and in contrast between the tissues, and it's a three-dimensional image. So that in and of itself is perhaps the biggest advantage to the surgeon. For most of us who've been doing sophisticated, advanced minimally invasive surgery for many years, the advances in the DaVinci system are a technological marvel. We have been able to do all of these procedures with the laparoscopic technique even before the DaVinci system arrived. But with the DaVinci system, we have some new tools in our armamentarium, a better visualization, and some more sophisticated articulating instruments. There are frontiers that have yet to be explored that will involve the DaVinci system being able to get to spaces that we cannot get to as easily with other existing technology. There are times, for example, where we're working in the pelvis with a difficult rectal tumor, for example, where the DaVinci system offers some unique advantages. There are other places in the body, for example, in the chest cavity or in a difficult hiatal hernia situation, or perhaps in an adrenal tumor, which I'm removing, where the DaVinci system can offer superior imaging and superior instrumentation. It's not also to be overlooked that the system has a very well-designed ergonomic design features for the surgeon. The surgeon is sitting at a comfortable console. The surgeon is not standing with hunched shoulders in a difficult position where he's becoming very fatigued. So it's allowed surgeons to be more relaxed and more comfortable and to be able to approach some difficult situations with a great view and a sense of comfort and a very sophisticated method of tackling technical challenges that may arise. What we've seen is that the DaVinci system is very appealing for both patients and surgeons. It has come quickly to dominate the field of prostatectomy, and it has slowly crept into use in many other areas of surgery. In colorectal surgery, which I do, and in other types of GI and abdominal minimally invasive operations, I think the DaVinci system has a role, and I think as it continues to advance and in the future will allow us to use less incisions, less ports, then I think it will begin to establish advantages over existing technology. The DaVinci system really represents one step forward in the technological advances of minimally invasive surgery. The biggest revolution of minimally invasive surgery came when we moved from open incisions and using our hands and traditional instruments to making very small incisions and working with a camera inside the abdomen. So that was the big revolution. That led to the dramatic shortening of hospital stays, dramatic reduction of pain, dramatic reduction in the recovery time after abdominal operations. Just think of gallbladder surgery, for example. I know when my grandfather had his gallbladder surgery, it involved a big, long, open subcostal incision. And then when my dad had his gallbladder surgery, it involved small laparoscopy incisions. And the difference between their experience and their recovery process was night and day difference. So that was the big revolution. What we're seeing now is that the DaVinci Robotic System is this technological advancement to much higher resolution imagery, much more sophisticated instrumentation. And I think in the future, as they continue to develop single-site robotic instrumentation, we're going to see a move toward even less incisions and even less scarring, even less recovery time. It's really quite something to work with the DaVinci Robotic System. It's really a privilege to be able to make use of this quite amazing technology to help people in removing their tumors and solving their abdominal surgical problems and watching them heal and recover very quickly. It's really been quite something.